Hi, this is Dr. Tony Scuderi for InterCoast College. Uh, this is on professional growth and personal growth for those that are in my class studying. Welcome to class. I'm glad you chose this. Uh, I'd like to just talk about a few things, hopefully to accentuate the material that you're going to be studying, the material that you're going to be using. First thing I'd like to talk about in professional growth and personal growth is personal growth. As a counselor, therapist, for those of you that go on, personal growth is going to be a very, very important thing. What does that mean? I see personal growth as one's ability, one's excitement to continue to work on yourself. Growth doesn't only necessarily mean academics. Great. Your personal development is all things around what you need to do to enhance your ability to be a better counselor, be open to people. When you're in session, you're going to learn a distance. One of the things is to listen, not only have knowledge, carefully to your patients. You have a very good life as a counselor. Personal, very important for you to get to know yourself because what you um, put out there for the patient is you and only you. So if you're a phony, your patients are going to pick it up. If you're genuine, your patients are going to pick it up. If you're somebody that really cares about people, your patients are going to pick it up. The personal development part of it and the personal growth of it with the educational portion is more in your professional acumen. You want to be an administrator? Do you want to be good at what you do? Because, this is a craft. This is a science that changes constantly. You have new theorists in there. You have new people that teach, learn, and write about different techniques and different styles. So you're going to have to find your own style. And as the years go on, one of the best and add to it in different areas. The other thing about personal growth is knowing family secrets and acknowledging them. Things I've seen over the years, and I've been doing this for over 30, 35 years now, as a psychotherapist and a counselor and a therapist, is when I see patients, and in my own early years in my developmental studies of myself as being a therapist, family secrets, those things hidden from you, or those things that you know that you're not allowed to talk about, can harm you. If you don't know anything or much stuff about your family other than some of the harm that they've done to you, I think you need to take a look at your family history. Ask your parents, your relatives, your friends that are in your family who are these people. Not just about if you've been abused, if you've been traumatized, little things that get in there about Uncle John, about Aunt Mary, or whatever it may be. Your mom, your dad, your brothers, your sisters, the whole family system, as we call it. Understand these secrets. Once you understand these secrets, what that will do is you'll be able to embrace those issues around these things up in your patients. And you'll be able to join with your patients, not have countertransference. One of the things that family secrets have a tendency to do if you're a professional in this field They tend to get into your mind and into your heart. And as you're listening to your pain, what it will do is it will cause a lot of distractions in your sessions. And if it causes distractions in your sessions, part of that's going to cause dissension. You're going to wind up doing your own stuff in session. Countertransference is going to, you're going to lose patience. And if you're working for a company or agency, you can probably get fired. Okay. So know yourself. If there are any family secrets in there, reveal them. I would suggest that you go into therapy and you start to work on them. Like I tell my students on grounds and sometimes online, there are two things you need: a good shrink for yourself and malpractice insurance. The thing is personal history. What is your personal history? Think, and it's not necessarily, oh, I'm an addict, I'm an alcoholic, but what is your personal history? Who are you? What are you about? What is your background? What is your culture? Very, very, very important in the therapeutic situation. And as you're growing professionally and personally, part of you integrates into you and changes you every moment history comes into this. How do you accept disappointment? How do you accept joy? You accept yourself for the good, the bad, the indifferent. You have to be a perfectionist. Are you the kind of person that sits, um, I want to help people because I was an addict at one time, and I know I can reach people. You know, I think you need being an addict or being somebody in need or somebody that's been mentally challenged or physically challenged. Right? Who are you? What is your personal history? How do you get along with people? How did you get along with your siblings? How did you get along with your parents? Was there anger? Was there fighting? Was there arguments? Was there love? Was there care? Was there compassion? Because all of that stuff that you you're going to bring with you had in the past and supervised in the past have sat there and have told me, Dr. Tony, geez, I never thought that I'd be like my father or my mother or my aunt or my uncle. Or when my patients talk to me about abuse that they've had, came up. And I had a difficult time. Take a look at this again in therapy if you need to. As I said, one of the most important things you're going to need throughout your career is a therapist. Whenever I treat like a therapist, and then I talk to the person, I interview them, I see which one is compatible with me, and then I sit here and say, look, this is what I'm doing. I'm treating patients. I've dealt with a lot of my issues in the past, but I'd like to use you if I can for some of the day. I'm sure some of the stuff that the patients tell me may trigger some things in me, whatever that is. Okay? The unconscious month, or more if need be, and I make the arrangements with the person. Do that because that's going to make you a better therapist. That's going to get your personal history where it needs to be. Now, for those of you that are in recovery, this is a very touchy field for you. Okay, your recovery, uh, part of it needs to be you becoming a healthier person, not to manifest that healthiness by carrying. That will get you sued because it winds up happening is your counter transference patient, the patient becomes therapist. Now, try to have that happen if you've got a patient that's either has a co-occurring or delusional disorder or maybe somebody that has a history of the same type of trauma that you've incurred. If you're not taken care of, if you haven't looked at this, it's going to come up in session, and your own recovery is going to be in jeopardy. Don't think just because you're in recovery with years or so that it's going to be real easy for you to treat patients. Just because you're in recovery doesn't mean you know what you're doing. It doesn't. I don't care what anybody says. It doesn't. You need education. You need foundation. Not necessary if you're good, if you understand yourself. If you're in recovery and you're doing treatment so that you can maintain your recovery, or you're in recovery and you're doing treatment and you're a narcissist and you think that you can help those people that are out there because they're just like you, get out of the field. Seriously, we don't need you in the field. That hurts people. Recovery, you're in recovery, you've got a sponsor, you're going to meetings, you're not touching drugs and alcohol, you've been through the education, you're continuing your education, you've got your malpractice insurance, you've got your therapist, you've got your support group and your support system, and you know how to use your tools. The other thing you have to realize is that your recovery and what you did to stay in recovery and to get there, not necessarily what somebody else has to do. As a recovering therapist, one of the things you have to know and you have to realize is everybody's recovery is individual unto themselves. You can take some of the stuff that you went through and you can give that to some of your patients and sit there and say, this is what I did. What do you think? What are you going to do? You know, talk to them. Don't tell a patient what to do. The moment you tell a patient what to do, except, you need to go to a meeting because of this, you need to stay sober because of that, you need to get into a deep detox. You need things like when the therapist comes up and says, "Well, I did this, and this is what you have to do to stay sober." You should never do that with a patient. And if you get a sponsor that says that, run like hell. That's not a good sponsor, right? Is for you to understand your own recovery if you are in recovery, and how did you work the steps? And to understand the steps are a guideline for life that you have to follow for the rest of your life. People, you have to reinforce into them how important 12 steps and 12 conditions are. So you're a healthcare provider, and all of this centers around your transference and countertransference. One of the things that you need to look at is the things that trigger you and have triggered you. And as you're going through your counseling practice with people, a lot of this stuff that's deep inside your own, and the things that slowly come up that Jung takes a look at as he starts dealing with his mandalas and the other materials of tapping into the unconscious materials, everything the psychoanalytical school teaches. Right, it's very valuable for you, the therapist, because part of this deals with when the patient is in session and sees you as either that authority figure or as that individual that hurt them in the past, right? And that transference comes out of them and projects onto you. How are you going to handle that? Are you going to take a look at that and take umbrage to it and be offended by it and sit there and try to keep your calm, but at the same time, your affect, your emotions going to be kind of like angry looking at the patient, sort of like, how dare you? I'm not that person. Or are you going to be able to take a look at this and sit there and say, this is some of the stuff I need to look at in me. I need to contain this now. When I'm done this, I'm going to take this to supervision and I'm going to take this to my therapist. I'm going to repeat it again. There are three things you need as a counselor. One of the things is a good supervisor, a good therapist, and malpractice insurance. Because when you're countertransference, right, unresolved conflicts that you have inside, unconsciously or consciously, come out and are projected onto your client, or acted out in the milieu, in the process of therapy. That is no good. That's what countertransference is. So understand that as you're in session and as you're in therapy, the transference and countertransference is going to come up quite often. And as it comes up quite often, you have to be able to recognize it, write it down, go to your supervisor, back into the practice. Never, ever, ever treat yourself in. Um, very, very important. Never do that. We do that with our patients, especially those with co-occurring disorders or delusional disorders, or people that are out of touch with reality in one way, shape, or form. We always try to reach back. We always try to give them a sense of a reality. We call it grounding. We try to ground them in reality, because sometimes a lot of their phobias or their fears or the reasons why they come to you, or even their low self-esteem and poor self-image, is due to, as the people in CBT and REBT would say, irrational thought process. The irrational thought process is irrational in reality, and we teach our patients how to deal with reality through the CBT or REBT techniques, the thought stopping, or the journaling. It's very important for us to do the same thing. We have to remain grounded. All right, we bring ourselves into therapy, changed individuals. We're not grounded within ourselves if we don't understand the things I've just talked about, our own transference, countertransference, our own recovery, if you are in recovery, our own personal issues, our family systems issues, and our personal development stuff. If we don't understand that, if we're not in touch with that, if we're not grounded within ourselves and within reality, that can be quite devastating. Not only for the patients, but for us. That can lead us to more serious mental health issues. And unfortunately, throughout my career, I've heard of and know some therapists that have not been grounded within those emotional issues that they have, and unfortunately committed suicide. That does happen. Or have lost their license and their credentials because they acted out in session or outside of session with that they had neurotic transference towards, or a violent transference towards. So always have reality challenges, and your responsibilities. Others are very personal growth and your personal development. You always, always, always have to challenge yourself to be better than what you are. Never think you're the best, okay? Because there's always someone out there better than you. I'm also a martial artist. I've been one for since 1970. I'm very good at what I do, and I hold very high ranks throughout the world. But the problem is, one of the things that keeps me to where I am, keeps me humble, is to know that there's, no matter how good I am, there's somebody out there better than me, and it doesn't have to be a martial artist. Okay, just remember, there's somebody out there better than you. And the idea for your personal growth and your personal development is to understand that what you'll be doing for the rest of your life, once you're credentialed and certified, is you will be doing a practice for the rest of your career. That's why they call it a practice. Your skills, you take your knowledge, you take your love of the craft, you send it out there, and you try new things, never experimenting on your patients, through research, through understanding, through personal growth and development, and through learning things, you improve yourself day by day. So, welcome on your journey. I hope that as you continue in the course of professional growth and professional development, that this helps you a little bit and focuses you and grounds you a little bit. So good luck to you as you continue your studies, and welcome to my class here, and have a very, very good mod for now. Dr. Scuderi for InterCoast College. You can reach me if you need to at Bishop Tony Scuderi at gmail.com or anthony.scuderi at intercoast.edu, which is preferred, or a problem with, please feel free at 916-767-7876. Bye for now.